Namaste everyone, this is Dr. Vaishali Lokhande, Consultant Physician, Apollo Hospitals, Navi Mumbai. We all are going through the episode of this COVID pandemic. Today we'll just understand a bit about what precautions can people take, especially those who have had episode of COVID and they are mild cases or they are family members of positive patients who are not much symptomatic. So let's say a person gets some vague symptoms and sees a doctor and the test is done and turns out to be COVID positive. What should he or she do? So supposing the patient is seriously ill, having fever and breathlessness or cough and requires hospitalization, then it is an easy job. You see the doctor admits you and refers you to the right center. For people who are young and healthy and who have very mild symptoms like just say dry cough and occasional fever, who are able to feed themselves and are comfortable and feeling generally well, they are advised home isolation or home quarantine for now. Usual period is at least 7 to 15 days. So who all can qualify for home therapy? A person who is otherwise healthy, does not have any comorbidities like diabetes, hypertension or chronic lung problems or is a cancer patient on chemo. These people obviously are kept under observation because their risk of complications is high. But otherwise, people who are healthy, not having any issues and just vague symptoms can be managed at home as per the doctor's advice. Precautions to be taken when you are in home isolation are, first and foremost, the person who is positive should be kept in a separate room with have an attached separate bathroom, not shared by the family members, so as to prevent the spread between the members. Number one, the person should be confined to his or her room at all times and be wearing a mask at all times. The person caring for this patient, let's say whoever is supplying food or water or other requirements, should also be wearing a mask whenever he or she enters the patient's room, should be also donning gloves when taking care of the patient. The patient's dishes and clothes have to be washed separately. The person handling those clothes and dishes should be wearing gloves and masks so as to prevent possible contamination and infection. About self-care, the person who has been self-quarantined at home should be advised, following the doctor's advice strictly. Take medications after the doctor advice. You don't have to be going to the hospital if it's feasible, and try to do video consultation the way we do at Apollo 24/7. And watch for some symptoms like worsening of fever, worsening of cough. If the patient feels fatigued on walking even short distances to the bathroom, or feels extremely lightheaded, or is feeling short of breath on saying few sentences, definitely there is a drop in the oxygen saturation. He or she should seek the medical advice at the earliest. People who are on home isolation are also asked to monitor their pulse oximeter saturation. That's a parameter which mentions how much is your oxygen saturation in the blood. Normal people have a saturation of 99 to 100% on room air. People of COVID who are suffering from COVID and have possible lung involvement, the value has to be above 95% at all times, while resting, while sitting, and even while walking and talking. If this value drops below 95% at any time point, he or she should be seeing the doctor or see the hospital at the earliest where there's a COVID care facility available. Usually patients of COVID who are in home isolation are given beyond their regular medicines, vitamin C supplements, B complex, zinc, they're given their vitamin D shots. All these should be strictly followed. People who are feeling tired or breathless should see the doctor at the earliest. And of course, the rest of the family members who are having even mild symptoms should get medical advice and get themselves screened for COVID at the earliest. Thank you.